Hey everybody, Dr. Ward with the Ward Institute. I wanted to talk to you about one of our favorite procedures, and that is surgical facial contouring. I'm very enthusiastic about this procedure because I have made a modification on it that I think really enhanced results. So surgical facial contouring, for me, the history of it is it started with buccal fat removal. So the buccal region is the cheek region, B-U-C-C-A-L. You say it buccal, not buccal. Buccal fat removal has been done for decades, where we remove some of the fullness here, we take out some of the fat, and traditionally we've just thrown that away. Well, the approach that I developed is a little bit different. We remove this fat, but instead of throwing it away, we reposition it up here. I like to leave it in there and just reposition it here. So we remove it from down here lower where we don't want this fullness. We put it up here on the cheekbone where we do want it. It helps give kind of a more pleasing contour to the cheek. So that's the first modification. The other modification that I do is I frequently do liposuction for this lower part. The buccal fat is kind of more up here, but this lower part becomes an issue too for a lot of patients. So I like to do some liposuction in this area here. And the way that I think about it is if you think about from the outside of the cheek to the inside of the mouth, there's roughly 5 layers. This is kind of an oversimplification, but it's how I think about it. There's 5 layers. There's the skin on the outside. There's the mucosa of the cheek on the inside. Right in the middle is like the muscle of the face. On the area right here by the cheek on that side, there's the buccal fat. And that's where we'd remove that. There's the other fat that's kind of more just right under the skin. That's what we do the liposuction for. So it's really kind of a two-pronged approach to give people the sort of result they want. One word of caution that I would say is you need to be really careful. When we're doing this procedure, we need to be very careful that we don't remove too much. I think that it looks really weird when somebody has like a totally sucked in cheek appearance like this. It looks just weird. So we want to be very careful to maintain a natural look. That's especially important because as we age, our faces get thinner. So we don't want to give an unnaturally thin or skeletonized look. It's also not for everybody. You know, there's some people that have always had a thin face. And if they come in and say like, hey, Dr. Ward, I want this procedure, you know, I want to look a little bit more defined there. Like that's the sort of patient that you need to, if you even consider doing the procedure, which often will just say no, if we consider it, we have to be very conservative because we don't want to take too much out because it's going to look funny. It might look great for a few years, but when they get a little bit older, it'll look really weird. And you can do something to treat it later on, but who really wants to have to go through another procedure? I'd rather just have my patients look natural always, when they're young, when they're middle-aged, and when they're old. In terms of other things that we frequently see with this is sometimes it can be associated with a little bit of an undersized chin. So sometimes we'll put a chin implant in here. Oftentimes we'll do something under here. So I will often do liposuction of the chin, but sometimes it's not fat that we're removing. That's what liposuction is removal of fat. Sometimes it's addressing these muscles. So sometimes I'll do a deep neck lift to really tighten that up here, to give tightness here, to let the cheekbone and the mandible stand out a little bit more. It gives a beautiful result. And remember, like so much of facial plastic surgery, this is about making the focus to other people and to yourself. When you're looking at yourself in a mirror or in pictures, be on your eyes and on your mouth. We want to enhance your natural appearance, which comes out through your eyes and your mouth. So we don't want to do anything to jeopardize that. So that's kind of the surgical facial contouring. I call it the Ward MD surgical facial contouring approach because that's kind of the technique that we utilize to help do that. In terms of risk of the procedure, there is a risk of infection, there's a risk of bruising, there's a risk of bleeding, and a risk of swelling. That risk is very, very low, but it's something that you need to be aware of. We will often have you wear kind of a little wrap around your face that can help, not always, but often will. Internally, you have a couple tiny little incisions in your mouth. They're so small, I don't typically close them. I used to close them in every case, but then I thought like I'd rather just have it heal naturally, and it works extremely well that way. The other thing that you need to be aware of with this procedure is that when I do the liposuction here around the muscles here, I'm working right on top of those muscles. You have to be very, very delicate because if I'm too superficial, you might see some of the results of the liposuction where you see like kind of funny pits or divots. If I'm too deep, then I can damage the muscle. So I want to find right in that sweet spot where we're removing right where that fat layer is. But because we are working on that muscle, it can take a while for that muscle to recover. So sometimes people after the procedure, for the first few months, even after, they might feel like it's hard to kind of move their mouth the normal way, or they may even feel like it's difficult to say certain words. Like if they have to purse their lips, it might feel a little bit weak. That always comes back. I've never seen a case where it didn't, but it's important that you are aware of that and make sure that you know. So I talked a little bit about the incision placement. There's an incision on each side of the mouth here. I also, for the lipo, will make a little incision back here behind the ear, so it's hidden. And I'll do the liposuction here and the liposuction of the neck here. If I do need to do more of the deep neck work, I'll make an incision here and kind of tighten those muscles and help give better contour and definition to that area. So that's the surgical facial contouring procedure. It's one of our favorite procedures. It's the right procedure for people who are younger, who maybe don't need a facelift yet, but want a real change or shift. So think of like the kind of somebody with a fuller, rounder, maybe even chubbier face that we want to kind of give better contour. They're the perfect patient for this sort of thing. So in terms of recovery after the surgical facial contouring procedure, it's roughly about a week that you need to recover, with a few months though where you feel kind of swollen. Maybe it's like hard to move some of the muscles around your mouth. It'll take some time to get better, but it will get better. It just takes time. So recovery is really pretty limited. Most people take about a week off of work and normal activities.